Healthcare in the US is in transition, some would say under attack.
Costs of healthcare are increasing rapidly.
Ici, on se bat un peu pour sa survie, quelque part.
The expectations of healthcare have changed immensely in the last few decades.
We need to have the strong support of foundation so that our clinical activity can do their best.
Tous les métiers sont en train d'évoluer, on est sur une vraie révolution.
Healthcare can do a lot of good things to people. So people want to have good healthcare, and you have to pay. Because healthcare is expensive. The patients are critical, they are emancipating themselves.
Patients' expectations now are far higher, absolutely appropriately so. This is part around health education that's gone around, it's part around social media that's put it out there, it's certainly the internet that's allowed people to easily search their own conditions and also share experiences in a very easy and free way.
Globalement, le secteur, et ça c'est la grosse autre tendance de fond, se retrouve confronté, mais je pense que c'est un peu un mal commun dans la santé dans beaucoup de pays, à des tarifs qui sont au mieux stables, avec des coûts qui, eux, par contre, augmentent avec l'inflation.
So it's a mondial problem. We have to be in control of the cost of healthcare.
There's been a 10 or 15-year trend for a move away from inpatient services to having patients receive care more in an outpatient setting. Technology has helped us to reduce lengths of stay. Healthcare has changed both from just a pure economic perspective, but also from a quality perspective, saying it's better to get patients out of the hospital, less infections, lower cost, higher satisfaction, and that all equals value.
La durée moyenne de séjour, donc DMS, il y a 10 ans devait être à 6-7 jours. Aujourd'hui, je pense on est plutôt entre 3 et 4. Et à 10 ans, on devait faire 20% de notre activité en chirurgie ambulatoire. Et aujourd'hui, dans un établissement classique, on est entre 65 et 70% en ambulatoire.
Ways that we can reduce cost is by cutting out overhead, reducing duplication, streamlining management, engaging in better training, and above all, utilizing our workforce to maximum productivity against evidence-based standards that helps us to offer a product at a lower cost.
Réorganisation, ça veut dire polyvalence. À un moment, c'est ça. On ne peut plus continuer à faire ce qu'on faisait avant. Qu'est-ce qu'on fait? Est-ce qu'on fait des services par spécialité, par durée moyenne de séjour? On est toujours en train d'essayer de nouvelles formules.
Vous avez des établissements qui se repensent d'un point de vue organisationnel et architectural aussi.
Il faut qu'on augmente absolument notre chiffre d'affaires. Pour augmenter notre chiffre d'affaires et jouer sur les quantités, il faut que ce soit nos blocs qui tournent plus.
Vu que vous êtes un peu obligé à avoir des volumes importants, très clairement, vous rentrez dans une logique de, on va dire, de concurrence pour des parts de marché.
The US market is changing to the extent that patient satisfaction never had an economic value to it. Under the Obama plan, rightfully so, hospitals will get paid based on the experience their patients have.
We have to distinguish ourselves as a hospital. We have to make sure that our patients choose our hospital and do not go to the neighbors.
Today at Lowell General, 95% of our admissions, patients coming to our hospital for inpatient care, receive a private room, a private bathroom, and the ability for family and friends to stay over to support them in their recovery efforts.
So the patient is in the driver's seat. Maureen Bisignano, she's the president of the Institute of Healthcare Improvement in Boston, once said, normally we ask the patient, what's the matter with you? And we have to forget that. We have to ask the patient, what matters to you?
Making sure the rooms are clean and disinfected, making sure that their food comes up one tray at a time in our room service, making sure that when folks deliver their food tray, they knock on the door, say room service, and they set their tray up, and before they leave, they say, is there anything else I can do for you before I leave? If hospitals are going to survive, patients are going to need to leave their experience telling stories about us.
Vu que l'aspect médical est presque désormais, je ne dis pas indifférencié parce qu'on n'en est pas là, mais en tout cas toujours de bonne qualité, c'est sur les aspects un peu périphériques qu'il faut aussi se battre pour montrer qu'il y a une attention particulière au patient qui est aussi un client.
You really are turning a supertanker. Everyone in the hospital community understands what care standards are. They experience it every day when they go to a Costa coffee outlet. The need to train them today to deliver high quality customer standards to the patient at the point of care.
We are asking feedback from our patients. They love it. I can even order a glass of wine in a hospital, but only if the nurse approves. And he or she has to pay for it.
Nous avons au quotidien des centaines, voire des milliers de patients, et toutes ces personnes-là sont finalement des clients potentiels d'autres choses que nous pourrions mieux servir et par là trouver des nouvelles sources de revenus.
Hospitals don't get that by doing it on their own. Hospitals need to find best practice. Hospitals need to find world-class providers of support services to help them along. We're great at taking care of patients. That's not our strong suit of cooking food or cleaning. We need to find world-class partners. Self-operation, I believe, is a dinosaur that's going to go away.
We need the people who can do the big picture, many things. We don't want to go out many times and look for maybe 10 different people who do 10 things. We need maybe a few people who can take care for all of it. We can learn from best practice of Sodexo elsewhere, and we can improve and adjust according to our culture and facility.
Je suis profondément convaincu qu'on devient toujours beaucoup plus intelligent en allant voir ce que d'autres ont fait. Moi, ce que j'attends de nos partenaires, c'est de nous aider à ça.
I cannot gamble. I can spend my euros only once, and it has to be good. So when we were looking, we were also searching for proven technology.
Ultraviolet technology brought into the patient's room by our Sodexo housekeeping team is going to take our infection rates down by half. If you put that into dollars, that's millions of dollars a year.
Conversation between parties involved is one of the most important key success factors.
Moi, je suis vraiment convaincu que le fait de s'inscrire dans un partenariat durable, s'asseyant du même côté de la table, vis-à-vis de la complexité que nous avons à gérer, est probablement la bonne stratégie.
We need a partner that understands our vision and mission.
Il va bien falloir trouver des choses. Et on en trouve. Hein. Et on en trouve.
This could work, but only if we join forces.
And a healthy dose of luck and good spirit to keep the costs down and high quality healthcare going.
We'll absolutely have an opportunity to survive, and not just survive, but thrive.